Podcast 23, Week 25. Welcome to the podcast, Your Pregnancy Week by Week. This podcast covers the 40 weeks of pregnancy in 38 segments and is based on the book Your Pregnancy Week by Week by Dr. Glade Curtis, MD, and me, Judith Schuler, MS. The information in our books and podcasts is a general informative guide about pregnancy. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctor. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your pregnancy concerns, questions, or interests into words. The goal of every pregnancy is a healthy mom and a healthy baby. To that end, our podcasts cover many topics. In each weekly podcast, we'll highlight information contained in the same weekly discussion in our book. We suggest you read each weekly chapter to learn further information, such as how baby is growing and changing and how you're growing and changing too. Our book also contains illustrations of changes in baby or you, advice for dads, charts, lists, boxes, an exercise for every week, a comprehensive glossary, hints, tips, snippets, and blurbs we just can't reproduce in a podcast. So let's get started on this week's discussion. We're going to look at week 25. Is baby a boy? A girl? This is one of the most common questions we're asked. Amniocentesis, CVS, and NIPT can all determine baby's sex. Ultrasound may also be able to predict baby's sex, but it's not foolproof. If you don't have a test that tells you definitely, you'll just have to wait to meet your baby. Are you feeling itchy? It's a common symptom during pregnancy. You don't have a rash or any bumps, your skin just itches. Itching may occur with each pregnancy and may also happen with birth control pills. The condition isn't harmful to you or baby. The best thing to do is try not to scratch. That can make it worse. Ask your doctor about using lotion, taking an antihistamine, or using over-the-counter hydrocortisone cream to stop itching. Follow his or her advice. Do you feel stressed as you get ready to head into your third trimester? We know pregnancy is stressful. It ranks number 12 on a list of life's most stressful events. Normal stress probably won't hurt you or baby, but major stress may increase risk of premature birth. During pregnancy, hormone changes can cause you to react differently than normal. That's stressful in and of itself. Relax and take it easy. Share your concerns with your partner or find a group of pregnant women you can talk with. Get enough sleep and rest when you can. Are you cleaning the house and doing yard work? We have some advice for you to help keep you safe. Avoid oven cleaners and aerosol sprays. Be careful with chlorine bleach, cleansers, and ammonia. Wear rubber gloves. Also, take care when you do yard work. Sit on something that provides support. Wear gardening gloves, and rubber gloves under your gardening gloves is also a great idea. A fall can be pretty scary. It's one of the most frequent causes of minor injury in pregnant women. Fortunately, a fall isn't usually serious. The uterus is well protected. If you fall, call your doctor. He or she may want to examine you. Some signs can alert you to a problem after a fall, including bleeding, a gush of fluid from the vagina, or severe abdominal pain. Minor injuries to the abdomen are treated as though you aren't pregnant, but avoid x-rays if possible. An ultrasound may be a better choice. Sometimes a bone breaks and requires imaging tests and surgery. You can't delay treatment. If this happens, insist your pregnancy doctor be contacted before any test is done or treatment is started. Anesthesia or pain medication may also be necessary, but avoid general anesthesia when possible. You may need pain medicine, but keep its use to a minimum. Pregnancy increases your need for vitamins and minerals. Try to meet those needs through the foods you eat. But being realistic, we know that can be hard. That's one reason your doctor prescribes a prenatal vitamin for you to help you meet nutritional needs. If you need more than a prenatal vitamin, your doctor will advise you, don't take supplements on your own. It could be more harmful than helpful. Did you know having a thyroid condition can make it difficult to get pregnant? Having an underactive or overactive thyroid can prevent ovulation. If no egg is released, you can't get pregnant. A lot of women don't know this. My nephew's wife had this problem. After taking care of it, she was able to get pregnant twice and had a healthy son and then a healthy daughter. An untreated thyroid condition can also cause problems during pregnancy. Sometimes the thyroid problem appears during pregnancy. Once under control, you should be able to have a successful pregnancy and give birth to a healthy baby. Thyroid hormone levels can change during pregnancy. Hypothyroidism, an underactive thyroid, is the more common condition during pregnancy. Thyroid replacement is prescribed. We believe it's safe during pregnancy. If you have hyperthyroidism, an overactive thyroid, medication is also often prescribed. Because it passes through the placenta to the baby, ask your doctor to prescribe the lowest possible amount to reduce baby's risk. Ever heard of velocardiofacial syndrome, VCFS? It's one of the most common genetic conditions in humans, second only to Down syndrome in frequency, but not many people know about it. Children with complete VCFS are born without a thymus and lack T cells, which makes them very susceptible to infections. Without treatment, life expectancy is about 2 to 3 years. Severity of the condition varies, and every person is affected differently. Some children may be very ill, while others have no symptoms at all. Not all symptoms occur 100% of the time. Most people with the syndrome exhibit a small number of problems, and many are relatively minor. Treatment is always based on symptoms. The exact cause of velocardiofacial syndrome is unknown, but researchers have identified a defect in chromosome 22. Most people with VCFS are missing a small part of the chromosome. If the syndrome is suspected, a special blood test called a FISH analysis can be done. If the test shows chromosome 22 is not complete, the person has VCFS. Do you whiten your teeth? It might be a good idea to wait until after pregnancy to do it again. Most whitening agents contain hydrogen peroxide. We don't have enough information about how whitening agents can affect baby. Whiteners may also increase gum irritation. Wait until after baby arrives to make your teeth white and bright again. Familial Mediterranean fever, FMF, is a condition that occurs most often in Sephardi Jews, Ashkenazi Jews, Armenians, Arabs, and Turks. It's usually characterized by recurrent episodes of fever and peritonitis. The disease usually appears between the ages of 5 and 15. A high fever is usually accompanied by abdominal pain with joint pain and a rash on the lower leg. Most people recover quickly and are okay until the next attack. Narcotics may be needed for pain relief. Currently, no diagnostic test for FMF is available. The problem is diagnosed more on the basis of repeated episodes. However, researchers have identified the gene for FMF, which is on chromosome 16. If you have regular manicures or pedicures, you can still treat yourself to one during pregnancy. Choose a salon with ventilation hoods that remove contaminated air from the area and ask for a non-toxic nail polish. If it concerns you, avoid nail polish completely. Remember, our podcasts give you the highlights of what may be happening in any given week. Check our book, Your Pregnancy Week by Week, for more detailed information. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. It covers pregnancy from a man's point of view and provides lots of valuable information a man may find very useful. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It details topics covered in each podcast, so you can listen to a particular podcast or read a certain chapter week if you want more information, or if you want to check out something you missed or a topic we haven't covered yet.